Okay, we're back. Caller, don't worry. Passed an assembly, 10,000. I'm all over it. I wrote it thoroughly during the commercial break. I'll make sure I get an answer. If I don't know, I'm going to say I don't know. Nobody wants to hear some made-up answer. All right. Dick, finish up with what you were discussing, and then we're going to turn the mic over to Dawn for a little while.
All right. We were talking a few minutes ago about get everyone involved with the Medicare Savings Program. I gave you the income for singles or couples, $2,309 for a single, $3,127 for a couple. But I'd like you to do one other thing, too. Whenever you call us and you're a couple, try to make sure your spouse is involved in the conversation. I'm very concerned on some of the calls I get that only one person is involved in getting the information or understanding the information. Eventually, some things can change, and everyone in the family needs to know certain things. They need to know our number. They need to know the costs of these different things and be able to make a decision, an informed decision, about what Part D program to get. Some of them are different in terms of cost structure. Some of them are different in terms of the drugs that they carry, the formulations.
Well, it's a hot topic because the board's light up. All right, caller on line one. Michael Regan, how can I help you?
Listen, excuse me, on that aging thing, last year I had them send me an application for the $90 or whatever it is to save.
Yep.
I mailed it in, and I never, ever got a response. I mailed it to the Department of Social Service, whatever is up on Courtney Avenue.
25 Sigourney Street.
Yep, and I never, ever got a response, and this is last year.
Okay, what I would recommend that you reapply. Okay, I hate to have you do that, but I would suggest you reapply and make a photocopy for yourself. Because if you have no photocopy, you have no proof that you've sent it in. I've had this happen to several people before, so you're not the first one that it's happened to.
Do you drive?
Everybody crazy.
Hold on. Do you drive?
No, I don't. Hey, my buddy, Michael.
Good. I know this voice. All right, no names for HIPAA.
Oh, I know. I don't give no names.
All right. Most importantly, stop by the agency. It's 447 Wolcott Street. We will fill it out for you when you're there. Or you can always go by 84 Progress Lane. You said WCAAA, Western Connecticut Area Agency on Aging. They're fantastic. So that would be 84 Progress Lane. Either one. There's no fee for this.
I know that because they mailed me the copy.
Right.
As soon as
but the problem is you got
nice.
lost in translation. So let's just be proactive. Make one more attempt within the next day or two because it's going to be a hot topic. The board's all lit up. Let's get either to me on Wolcott Street, the big white building. My staff just did a phenomenal job. Way to be, Ange. We just made a commercial, by the way, our first commercial. It was not affordable by any means, but it's going to hopefully get me some business. Come over to the agency, park and back, or go to Progress Lane. The phone number for Western Connecticut is 203-757-5449. Make an appointment. Don't just have them mail it to you. And bring $1. If someone's going to give you a hard time, I doubt you'd give them a hard time about making a copy. But please ask for a copy. They will, you can always call them to find out. The progress is about 4 to 6 weeks. So thanks for listening. We're going to take the call on line 2, and hopefully you'll get it this time. Sorry for any confusion. Dick, this is going to be for you. Michael Regan, Medicare and You. How can I help you?
Oh, good afternoon, Michael. Thank you so much for your program. It's very enjoyable and informative.
Thank you so much for listening. I'm honored. Sometimes I think I'm talking to myself.
No, you're not. Not at all.
All right, good.
I have a question. My question is not on this program. It's on Social Security.
That's all me.
Okay. Now, here's my question. My wife and I are both retired. I receive my Social Security a check on the second Wednesday of the month. She gets hers on the third Wednesday of the month. But my question is this. Why are we not being paid in the beginning of the month? Years ago, people were paid in the third of the month. Everybody got a Social Security check. Now, why are we being paid 2 weeks later, 3 weeks later, or whatever?
Okay. I've been doing this show for over a year. Are you the gentleman who called in about 8 months ago and asked the same question when I had the Maria Grice from Social Security on the show?
But my question then was...
I remember your voice. Let me tell you, I got the answer. The answer.
Go ahead.
It is based on your zip code and when you turn 65. Okay. How young are you?
68.
And how young is your wife?
68.
Okay. Whose birth date is first?
Mine.
Are you the one who receives the check earlier?
Yes.
Okay, that's the best answer I could get. There's no BS here. That was the best answer I could get. The honest answer is, in my opinion, they're just holding your money, to be truthful. But the answer I got back from Social Security, and I can give you a local phone number that you could call them and ask them, because they're fantastic there. Teresa Teeter and her staff do a great job. It's a new location, but you can just call to get the exact answer. I sell Medicare products. I don't work for Social Security. So let me just tell you the answer they told me. It's due on when you turn 65. It's a rotating monthly scale. And the reason it's staggered is just so Social Security can hold the money as long as possible. The local phone number is 1-877-405-4874. 1-877-405-4874.
I get it.
And the new building is 51 North Elm Street. It used to be 95 Scoville Street. And I will talk to you in 2 weeks. Call anytime. It's just a pleasure to hear your voice again.
One more thing now. I understand your answer, and I assume that's what it was, cash flow for the government. But my question remains, what gives them the authority to do this? Is it codified in law? Is it a regulation? Who just decided we're going to start doing this?
They did.
But by what authority?
None. I don't know the answer to that. I'm only an insurance agent in Waterbury, Connecticut.
Okay.
I have no authority.
Some things you just can't explain. All right? The government says the sun's going to shine tomorrow. Go out and buy an umbrella because it'll probably rain.
That's not good enough. That might be
I hear you.
That's not good enough.
There's nothing wrong with standing up for yourself and asking for your damn money. It's yours.
They're holding my money.
Right. Which, by the way, you paid into. In order to receive Social Security, you didn't just work for a couple days.
No,
you worked for 10 years, 40 fully satisfied quarters, and hearing your voice is 68. You're still going strong. You probably worked 60 of those 68.
Sir, did you contact Social Security?
Not yet.
Yeah, well, I think I would be doing that. Give them a call.
Or call your congressman.
Well, the congressman, Rosa DeLora, is of no use to anyone. Yeah. I'll try and call.
All right, it's not a political talk show. It's not a political talk show.
That was the answer.
1-877-405-4874. Thanks for listening. Holy cow!
Oh, wow.
All right, that got heated. All right, so let's focus on you, the listener.
A little stimulation.
So anyhow,
Dick and Dawn keep shooting out the monthly number.
Okay,
I'm an annual person. So when you hear that number in your mind,
application is monthly.
Right, it does monthly, but just to make sure, just so you know, I'm sure a lot more than you think out there. I don't qualify. It's earned income, and for a single, it's $27,708. For a married couple, $37,524. So, all right, go ahead.
So this is not a Medicaid program, and I should point out you have to be on Medicare, disabled, senior, on Medicare in order to be on the Medicare Savings Program.
And the thing is, don't judge yourself as not being qualified.
Right.
All right.
I hear that a lot, too. Like, I own a home.
Get the application, go see Michael, or call us, or mail it in, or do whatever you like. But don't pre-qualify yourself, because a lot of people out there make that mistake, and then when I look over their application, because they bring it in 3 months later, I see they're qualified, and I don't even make that judgment. DSS does. Right. So don't jump off the bandwagon till you get affirmative or negative response from DSS.
So your income, when you're going to count your income, you're going to count your Social Security check. If they are taking the $99.90 out, you need to add that back in. Okay? You need to count your pension if you get a pension. If you have an IRA and you are taking a monthly distribution or a yearly distribution, you need to count that. If you have any interest income, you need to count that. If you're working, many people over 65 are now working, you need to count that. Also, many seniors are now getting, or others are getting unemployment. That's also counted as income. Dividends are counted as income. Social Security disability income is counted as income. If you have an annuity and are taking money from the annuity.
A stream of income off of the annuity.
Okay, thank you.
The technical term, you have to be technical. When someone has a policy annuitized, it means they're taking a stream of income. When it's in the accumulation phase, they still have an annuity, but they're not taking the stream of income. So, all right, go ahead. Sorry,
Okay.
Dawn.
And if you have rental income, that place down in Florida, okay, that you're renting out for the winter, that's counted. Alimony is counted as income. Workman's compensation is counted as income also. So those are your main income sources. Many of the people out there in the listening audience probably have your Social Security, you probably have a pension, and maybe some IRA distribution. As Dick said, many more people qualify for this than they realize. So absolutely check your figures. Give Michael's office a call. Give our office a call. We'd be happy to go over all of that with you. And as they said, assets do not count, meaning your home doesn't count against you.
The Rolls Royce in the garage, that doesn't count either.
Any money, if you have one.
Yeah, absolutely. Any money you have in the bank does not count. Only the interest that's coming from that money counts. But any money savings you have does not count. And the best part is there's no recoupment, meaning that the government cannot go and attach your home. Years ago, people would say, oh, I don't want to get on that program because they're going to come and take my home away. I won't have anything for my grandchildren. They're not going to come after your home, okay? So there's no payback to the estate. So this is a win-win program. It does take the application, as Mike had mentioned, takes about 5 minutes to fill out. You don't need to send any proof in, and just wait to hear from DSS on it.
The one thing you do not
figure
want to do...
it's going to take about 3 months for the thing to be processed.
The lag time.
The lag time, because we've been so busy sending them in that I think they're sort of like getting a little bit behind. So,
the one thing you don't want to do is misrepresent yourself, because that's wrong. And if you are caught, it is actually a federal offense. There was a couple that lied at a Farmington and received Husky for their family. This Husky program follows the same guidelines. It's an income-based program. So if you do have streams of income coming in and you blatantly misrepresent yourself, don't do that. This program is for the people that need it. One question we get all of the time is, what is that silver card? That silver card is the QMB Medicare Savings Program card. It will pay your copayment at the hospital. It'll also pay your prescriptions at the pharmacy, $2.60 and $6.50. No, it's not a scam. I know you keep saying that's no way. Go and see the people at Western Connecticut Agency on Aging. The reason, are you a state-run agency?
State and federal.
State and federal. Okay, so the reason these programs are out there...
No, we're a nonprofit.
Right, it's a 501c3 or a 501c6. Yes. But the concept is, the reason you're out there is that I always say on the show, this should be your first step along the way to retirement and not estate planning, but just planning.
Mike, I would like to point one thing out to your listeners. If you qualify for this program at the limits that we have told you, which was, again, $2,309 for a single per month, $3,127 for a couple, okay, this is going to entitle you to extra help through Social Security, whereby you are going to be paying $2.60 for your generic medication, $6.50 for your brand name. Many of the Part D plans are going to be paid for, so their average price a month.
Benchmark
Well,
plan.
the benchmark plans are going to be paid for, right? But a lot of people don't know what a benchmark plan is.
Right, well, go ahead, explain that. We have plenty of time. Please do.
Go ahead, Dick.
Now let's not worry about details.
All right, well, I know what a benchmark plan is.
The benchmark plan is a plan
is one that has qualified through the proper ratings and the reimbursement. When a benchmark plan is put in place, if it's a standalone prescription drug plan, if it's one of the qualified benchmark plans, the premium, just say it's $34.30 monthly, will be paid by the program. So one thing I see...
That's the reason on the application, it calls for, there's a short little section where it calls for your insurances. You put the insurances down so that if you do qualify at certain income levels, the state then will have the number to pay for those bills, pay for those plan expenses.
Right.
So if you don't put the number down, they won't know it, and then you'll say, why am I still paying $33 a month?
Because you didn't indicate that you had it.
Yeah.
All right, go ahead.
Okay, and on the program that Michael was mentioning where it will pay your hospital deductible, it'll co-pay for certain doctors, that program you have to have a lower income level.
QMB.
Okay, and on that income level, your income has to be about $1,983 a month. For a couple, it's $2,685 a month. But we always like to start off with the highest level. Okay, because I think it's important that everybody try to get
just
on.
Realizes that they can get the Part B back. That's a $1,200 a year raise.
Well, it's not only that they get their
and
Part
it's been
B
around
back.
since 1988.
Right.
Yep.
Now, do you refer to it in the industry like QO3?
No.
Medicare Savings Plan. That's
just
it.
not Quimby, Slimby, nothing. Just straight.
That makes it too complicated.
Okay, just a Medicare savings plan.
That's an in-house discussion.
Keep it simple. Keep it simple, stupid. Love it.
Call us, collect your money, and have a good day.
Most people are out there listening. One thing you can do is if you qualify for this program and you have a Medicare supplement that is costing you $250+ a month,
or a lot less.
But if they have a supplement out there, this will give you, if you qualify for this, what we insurance agents refer to as a SEP, a special enrollment period. The government will give you 63 days from the date of acceptance, the first of the month following date of acceptance. You can apply for a different, more affordable, cost-effective Advantage plan. Now, if you're under 65, the only Medicare supplement with Anthem Blue Cross Blue Shield, a very strong carrier that I sell, you can only get Medicare supplement initial A. With United Healthcare, another quality carrier, you can only get A, B, and C. So if you're on those programs and you're disabled and it's getting to be costly, if you qualify for this Medicare savings program, it will give you a window of time out of lock-in. From October 15th through December 7th is the only time you can change your plan in United States of America. It's called annual election period. If one of these programs, all right, producer Tom's telling me to take a commercial break. We'll be right back in 2 minutes. Thanks so much for listening.